Assalamualaikum. My name is Akshay Javed and I am the final year student of Dow University of Health Sciences. Me and my group members are here to give you a brief information about opioids, their analgesic mechanism, its adverse effects, and how it's used on surgical site.
Hello everyone, this is Saiba. I'm a final year student of Dow University of Health Sciences.
Hi, my name is Maham Khalil. I'm final year student from Dow University of Health Sciences.
Hello, my name is Anmol Amin and I'm a student of Dow University of Health Sciences.
Hi everyone, my name is Shazleen Naeem. I'm a final year student from Surgical Technology. Without any delay, let's move towards the video. And we hope you guys appreciate the effort we have made for this video.
If we talk about analgesics, these are the drugs that relieves pain. These do not alter your nerves. Hence, it does not affect the level of your consciousness. And for its classification, there are three groups. Number 1, non-opioids, or we can say NSAIDs. Number 2, opioid drugs. And 3, co-analgesic drugs. And now opioids. So what are opioids? Opioids are compounds that resembles opium. And opium is basically a dried latex which is derived from poppy seeds. Now opium, or we can say opioids, has the characteristic to weaken or taper off your body to brain and brain to body signal transmission. Coming towards its classification, there are 4 classes: naturally occurring, synthetic, opioid antagonist, and the last, mixed antagonist and agonist. Opioid receptors are found in the nervous system, where they are embedded in outer membrane of nerve cells. When opioids attach or bind to the receptors, the interaction triggers a series of chemical changes within and between neurons that leads to feeling of pleasure and pain relief. And now we will discuss the benefits of these two categories, that is narcotics and opioids. For narcotics, the benefits include reduction of stress, relief of aggression, and also an anti-anxiety drug. Whereas the benefits of opioids include an antidepressant and it also blocks your pain signals.
Let's talk about the adverse effects of narcotics. Some of the common adverse effects include sleepiness, constipation, while other includes shallow breathing, bradycardia, loss of consciousness. So, adverse effects of opioids include constipation, diarrhea, nausea, vomiting, dizziness, respiratory depression, and also it can cause physical dependence and tolerance. So less common side effects may include gastric emptying and hormonal dysfunction, muscle rigidity.
Some pharmacological actions of morphine are meiosis, that is decrease pupil size, nausea and vomiting, analgesia, respiratory distress, cough suppression, constipation, physical and psychological independence, and sedation, including much more which is listed below. Talking about morphine specifically brings the light on its analgesic property, that is, it relieves pain that is sharp and severe in nature. Moreover, it is a choice of drug in myocardial infarction, burns, acute pulmonary edema, fractures of long bones, and cancer pain. Now, methadone is a drug that causes repulsion from heroin or morphine. Pethidine have analgesic property similar to morphine. It is also an epidural analgesia for obstetric labor.
So in this slide, we'll discuss other uses of opioids. We'll discuss it one by one. Codeine is the first one. It helps to reduce the cough. Next is loperamide. It helps with the non-infective diarrhea. It is also helpful in irritable bowel disease or short-term diarrhea. So next is phentermine plus droperidol. It is used when skin is perforated with a surgical instrument. Right, and next is the very last is transdermal phentermine. It helps with chronic neuropathic pain. So adverse effects of morphines include vomiting, respiratory depression, constipation, and people who are addicted to morphine have needle marks, pinpoint pupils, depressed respiration, and constipation. So in antidote, we can give intravenous naloxone to reduce the effects of morphine. So, what happens when a patient is overdosing opioid? Opioids can cause death. That is because the strong effect on the brain which regulates our breathing. So if you see any patient overdosing opioid, you can observe these symptoms like pinpoint pupils, unconsciousness, difficulty in breathing, cold skin, snoring, or discolored lips. So what you should do in this type of situation is that emergency response is very important. The sooner you act, the sooner you will get the positive result. Naloxone is given to reverse the effects of opioids, and then it is metabolized in the liver. So in this slide we'll discuss the contraindication of morphine. The first one is head injury or head trauma. It's basically because during severe brain trauma or brain injury, the inflammatory response in central nervous system results in decrease in the expression of the transporter protein, which is P-glycoprotein, in the blood-brain barrier. So this loss results in the penetration into the blood of certain drugs that are normally excluded by the protein transporter.
Okay everyone, so lastly we will summarize the whole topic that we would not recommend opioids whenever a patient is suffering from mild pain or moderate pain and make a habit of it. Although opioids are effective pain relievers, people may become dependent on them or develop an addiction as well. But when someone takes these drugs for a long time without a prescription or in a different way than their doctor advises, so it can lead to addiction, overdose, and death as well. So a person should always follow a doctor's advice when taking opioids, because there are different types of opioids available. Certain opioids are legal to use while others are illegal to use. I hope everyone that you like our group effort which we put in the video. Do hit the like button, do subscribe, and do comment below. Thank you.